Hey guys, Christina here, and today I wanted to share some tips that we've learned over the years to save on medical costs. Now I'm going to talk a little bit about the US and then about Canada because I spent about 3 years living in the US and encountered the medical system there and learned a few things along the way. So if you're new here, we are a Canadian family. We have 5 children between the ages of 3 and 12, and we're also a homeschooling family too. So I'll start with my experience in the United States. I was there as a student, so I did have student insurance, but I still had to pay for my medical care. And I ended up having to go in for surgery while I was there, and then having complications and ending up with 10 days in the hospital, including time spent in the ICU. So I got some pretty big bills, which as a Canadian was quite shocking. But I did learn a few things. So first of all, there are community doctors or community clinics that you can go to. I did attend one. I think I paid $15 for it. It was kind of like by donation, whatever you could pay. And there's doctors treating people. So that was one option that helped me to save a bit on medical costs. In terms of the hospital, I did find that if you paid in lump sums or you paid in cash, they were willing to negotiate the fee a bit and to reduce the cost. Also in the US, you have a lot of opportunity to shop around for your doctor and your care. We don't really have that here in Canada very much. So take advantage of that, find out about pricing, about their fee guides, and get all the information you can before you decide on which doctor to see. Now, if you're a Canadian in the United States, make sure you register your time out of the country. Whether you're visiting, or you're just traveling, there's a place you can go on the government website to register your traveling, or if you're living there or you're attending school like I was in Ontario at the time. I registered that I was heading out of province, out of country for school, and when I ended up in the hospital, the province actually paid part of my medical bill. It wasn't a huge amount, but it certainly helped, because I had filled out the correct paperwork and I had everything in order, and they have a set fee that they would pay. I don't know if they still do this, and I don't know how each province works now, but it's definitely something to look into and to consider whether you're going for a trip, whether you're going for longer in the United States. Travel insurance, if you're going to be traveling, is another key thing you can look into for your own situation. Samples. Ask doctors for samples. I found we do have this in Canada a bit, but I found it a lot more common in the US, and that can save you from getting a full prescription, something to try. It's a way to save money. So then in Canada, where things are quite different, we all have access to basic medical care when you're a Canadian resident, citizen, on certain visas, etc. But there are things that are not covered. So here in Alberta, we have a number of social programs, especially for children. If you're under a certain income, they can get a benefit card, which allows them to access medications and things like that at a discounted or no cost fee. We have a number of other programs, including one for adults as well. So there's always a number of social programs and opportunities that way to save on your medical costs if you are eligible for them. We also have a program here in Alberta called InnoviCares. I think that's what it's called. You apply for a card and it's eligible for certain name brand drugs, and they help pay part of the cost of the name brand drug. You have to look it up, see if you're eligible, see if it's medication you would use, but I have heard about it. I haven't used it yet. I've heard other people have good reviews of it, so that's something to look up and to consider. Coupons is another one for those like over-the-counter Tylenol, aspirin, whatever, Imodium. There's usually coupons for these things you can find either from the manufacturer's website, from stores, sometimes through those rebate apps as well. You can find different ones to kind of keep that cost down there. Another one I think people don't always realize is you can ask the manufacturer to cover part of your drug costs here in Canada. I went through this when I was pregnant with my last child. I developed blood clots in my leg, and I was already on an anticoagulant or a blood thinner, but I needed a different one at a much higher dose, and we were looking at like $1,000 a month. There was no way we could afford this medication. So the doctor actually had a form that she filled out, and I took it to the pharmacy, and the pharmacy contacted the manufacturer and asked, would you cover the portion that this person's drug plan doesn't cover? And they said yes. So between the insurance that we had, the private insurance, drug plan, which covered, I think it was about 80%. The drug company picked up the other 20%, and I ended up paying nothing out of pocket for this drug I had to take for almost 18 months. Talk to your doctor. Talk about this form. They ask questions like our income, how many people were in our family, why we couldn't afford it. But this is an option that I think people don't always realize. So if you're struggling to pay for your medication or a prescription that you need, talk to your doctor and find out, can they do this? Or even contact the manufacturer directly and say, this is what's going on, what options do I have? Hopefully this has been helpful. I know there's all the basics, eating healthy, exercise, preventing medical care. But when you do need medical care, hopefully this has given you just a few quick ideas to help you save some money on your journey. I hope this finds you having a great day. Take care.